Hello everyone. In this video we're going to be talking about the non-alcoholic liver disease. So before watching this video I will recommend that you go and watch the topic alcoholic liver disease, because if you'll watch that first it will help you understand this topic much better. So let's start. So the non-alcoholic liver disease is a condition in which excess fat builds up in your liver, and this cause is not due to intake of alcohol. If you will do a microscopic examination of the liver in these patients, you will notice that the injury which happens to the liver is very similar to the alcoholic liver disease. It's so similar that most of the times it is very difficult to differentiate between them. But this condition is actually idiopathic, meaning we do not know the exact cause. Now, what are the risk factors for this disease? So, people who are suffering from metabolic syndrome X are at a higher risk of getting this disease. So, people who suffer from this syndrome are obese, they have high sugar levels, they have high levels of triglycerides, they have high BP, and also they have high insulin resistance. So to put it in simple words, people who are very fat are at high risk of getting this disease. Now, what is the pathogenesis of this disease? So the exact mechanism is unknown, but scientists have found that there is a very strong association between insulin resistance with this disease. Genetics, diet, and intestinal microbiome also have a contribution to the pathogenesis. So let's see what will happen if there is insulin resistance. So this will cause release of free fatty acids from the adipocytes. And at the same time, there is decrease in adiponectin. So adiponectin is a protein hormone which is involved in regulation of glucose and fatty acids. And this is mostly released from the adipose tissue. So a decrease in adiponectin will lead to a decrease in the oxidation or breakdown of free fatty acids by skeletal muscles, and it will increase the free fatty acid uptake into the hepatocytes. Also, the hepatocytes in this disease downregulate lipolysis, which is breakdown of lipids. So what is going to be the end result of all of this? So the end result is going to be the accumulation of fat inside the hepatocytes. So this is the most important point that you should know about this disease. So these lipids which are actually accumulated in the hepatocytes can damage the mitochondria and the plasma membranes and lead to cell injury. Now, what are going to be the pathological findings that you're going to see? So as we saw in the start, this condition is very similar to alcoholic hepatitis. And so we will see hepatic steatosis, lobular inflammation, and balloon hepatocytes. I've talked about these in detail in my video on alcoholic liver disease, so I strongly recommend that you go and check that one out. So again, it is very difficult to differentiate between alcoholic hepatitis from non-alcoholic steatohepatitis based on histological findings also. We will be able to see fibrosis which develops around the central vein and has a chicken wire appearance. So this is the chicken wire and this is the fibrosis in blue color which is seen in this disease. So as you can see, both of them have kind of a similar shape. So it takes very long to develop symptoms of this disease, which is why the cirrhosis is subclinical. And the cirrhosis is also called cryptogenic cirrhosis because the etiology is unknown. Coming to our last part of the video, a few important points that you should remember. In this case, the ALT to AST ratio is more than 2. So it is very important to note this because in alcoholic liver disease, it was exactly opposite. The AST to ALT ratio there was more than 2. Here the most common cause of death is cardiovascular system related. And this is easy to understand because what type of people have this disease? People who are very obese and have high levels of triglycerides and lipids in their body. So obviously you must be knowing too that such people who are very obese have a very high risk of getting MI or heart failure. So that's why this is the most common cause of death in these patients. Lastly, weight loss exercise can alone reverse the histological abnormalities in this disease. Why? Because doing this will reduce the amount of lipids and triglycerides in the body. So that's it for this video. If you have any doubts, so please leave them in the comments or you can message me on Instagram anytime. I will be leaving the link for my Instagram in the bio. Thank you.